Hello, my name's Beth. I chaired the Masterclass today. I think there's a couple of things that really struck me. One was about the variability of services that GPs have locally to refer to, and I think a lot of the people were really keen to take that back through their commissioning groups. I think the second thing was a cardiology talk actually. He made it really clear about some of the management that we really should be providing for our patients, and certainly the top 3 medications and the impact that we can have if we actually prescribe those drugs. So I really learned a lot today and thoroughly enjoyed it.
Well, as we discussed today, older people often have multiple problems, so the key first thing is to make a diagnosis. Think of your management as being a package, either for them or their carer. And really you need to use your clinical judgment, because as they'll have lots of different problems, you can't just stick to guidelines because they'll have so many interacting problems. So really use your clinical common sense and you can often achieve very good outcomes.
My key take-home message is to ask us a direct clinical question when you're requesting radiological investigations, and to give us as much information as you can. And don't forget to use those I refer guidelines.
Nowadays we have some good new treatments for multiple sclerosis. Be careful about overdiagnosis with MRI, but if you find a patient whose MS looks as though it may be going to cause trouble, the new treatments are really very effective. Side effects, slight problem, but hit the disease hard, hit it early, turn it off, end of.
I think the main advice I'd give to GPs when signing fit notes is to remember that this is an advisory note for the patient, not for the employer or for the benefits agency. And then it is a vehicle for which the patient can take that dialogue away from the surgery and back to the workplace where it really should be, to begin to look at the options for a return to work.
My name is Dr Cath Brizzell. I'm Head of Education at the BMJ, and I've had the pleasure today of chairing the BMJ Masterclass. We've covered a whole range of topics, so diabetes, gastro, urology, gynae, and I've spoken to lots of our GPs today, and what's really come across is that they are really happy to be here, because while they're practicing very safely in their environments, they do pick up lots of nuggets, and they say that's why they love coming to these BMJ Masterclasses.
The take-home message I'd like you to have today is the importance of getting to see the young person on their own at some stage during the consultation. It's very important to hear what they have to say about how they're feeling without them feeling inhibited by their parents being there, either because they may feel protective towards their parents or they may be concerned about worrying them.
So my key message is that if you've got a woman you're treating for heavy periods with medical treatment such as tranexamic or mefenamic acid, please make sure that they know how to take these medications properly, which is at the very onset of their periods and not on day 2 or day 3, because then it's too late. Thanks.
When you're treating patients with gastrointestinal disease, please always consider celiac disease with 3 separate scenarios: when there's unexplained weight loss, anemia of any kind, whether it's iron deficient or macrocytic, and last of all, where there's any abdominal bloating. If you do that, you'll have a pickup rate of between 2 to 5% of your patients who can then have a better lifestyle on a gluten-free diet after, and I repeat, after they've had a distal duodenal biopsy following the serology.
Men will get urinary tract infections from time to time, and when they present to your surgery, the dilemma is, what do I do? Men don't get urinary tract infections normally. Women quite commonly get infection, but men don't. Thus, if a man presents with a urinary infection, it's telling you something about the dysfunction of the urinary tract. And my recommendation as a urologist is that when patients develop a urinary tract infection, I think it should be measured by doing an MSU, treat appropriately, and then refer for urological opinion, since it's more likely than not that there's a urological abnormality.